Hi, my name is Abigail Rager, and this is the presentation on Pyramid Healthcare Outpatient Program. So this analysis takes a look at some services that are offered here at Pyramid, as well as identifying some gaps in service that we have in the program and proposes some recommendations, so how we can enhance care to our clients. We provide an essential role here at Pyramid Healthcare in treating clients who have substance use disorders as well as co-occurring mental health disorders. This analysis was backed by research, includes some ethical frameworks, practices that are anti-oppressive that we should assess, how the program is meeting clients' needs, as well as how we can further advocate for things such as human rights, cultural inclusion, and systemic equality across all levels of care. So again, this analysis serves three reasons. It's to critically evaluate services offered here at Pyramid Healthcare, identify the gaps that may hinder client success, and propose recommendations to improve outcomes. Backed by our mission here at Pyramid to develop and maintain a team of committed professionals that are passionate about identifying human service needs and creating solutions for individuals and family that will result in some positive growth as well as better quality of life. It's the core values that we have here are integrity, dedication, collaboration, and passion. And we enhance those over all levels of care that we have here at Pyramid. So our outpatient program here at Pyramid provides evidence-based treatment to individuals struggling with addiction and or mental health challenges. This is then separated into pregnant women. We treat them with some MAT that is tailored specific to pregnancy. We also take adolescents and youth that are struggling, as well as veterans. With that, we offer walk-in assessments. These can be done. We have counselors that are here from 5 a.m. to 5 p.m. The clients call into the call center and then they get placed on the schedule for the day, anywhere in the day. So they're placed in the morning and then we can see them anytime throughout the day. We also offer flexible scheduling. Again, clients are here typically seeing, or sorry, counselors are here typically seeing clients from 5 a.m. to around 5 p.m. So that allows for individuals to be seen. We have morning groups and night groups to tailor around work and life scheduling. So our program services, we offer a wide variety of services for the best possible care. Our most extensive is the partial hospitalization program. It's 5 hours a day, 5 days a week. We also offer the intensive outpatient program, the IOP program, 3 hours a day, 3 days a week. We have a morning and a night group for that. And next we have general outpatient program. It's 1 to 2 days a week, 2 hours a day. We also offer individual services, therapy. Usually it's bi-weekly. We see the clients for about an hour. The group therapy runs with the treatment levels, and we offer medication assisted treatment here, such as methadone, Subutex, Suboxone, Vivitrol, Brixadi, things like that. We have certified recovery specialists on staff that have been through addiction, have taken the classes and are certified to be here for peer support. We have a psychiatrist and a doctor that oversees like mental health. We tailor to clients' needs. With insurance, we are accepting private insurance, Medicaid, counting funding through like Blair Drug and Alcohol and local county SCAs. And we also offer self-care or self-pay options for clients to make payments we take payments so that clients can pay over an amount of time. So with the program assessment, we have multiple types of assessment, including intake assessments when clients first come in. That does everything from mental health to physical health to substance use. trauma assessments, smoking assessments, things like that. We also track clients' attendance. We look out for relapse indicators as part of the intake and treatment plans. We ask clients, what's detrimental to you, people, places, things like that. And we get client feedback via surveys typically or word of mouth to us. Um, so some of our strengths are we are flexible hours, peer support through our CRSs, and we are CARF and ACM accredited nationally to ensure quality standards here. There are several gaps in the program that should be assessed, such as we don't have a full-time CRS on site. We also have limited partnerships for housing and transportation coordination, as well as gaps where we could be more culturally responsive to our clients. Addressing these areas will work more to and have a better engagement for clients and attendance. For those who are facing multiple challenges at one time, such as housing instability or not being able to get here because they lost their license, etc. So, theoretical and evidence-based practices. We use a variety of evidence-based practices here in therapy. We work on cognitive behavioral therapy, motivational interviewing, trauma-informed care, and then obviously medication management through the MAT. Again, this is research backed that outpatient treatment is effective for opioid recovery. We found that peer support reduces the chances of relapse, and providing culturally competent care improves engagement. The gaps, though, is when researching this, there was no long-term data. So clients typically will come in, they get treated, they leave, and we don't hear from them after that. Or they come in and they just come for their assessment and don't return. So it's hard for anybody to get some long-term data on outpatient clients at any place. The also gap is that it's a broad diversity of clients. Most of them, yes, substance use, but it really didn't go into like culture or anything like that. So they were very broad studies. So social welfare policies shape our access to care here at Pyramid. We accept Medicaid and work with county funding to expand services for our low-income clients. However, funding is limited at times, especially when the turnover of the fiscal year happens, and a lack of transportation can point to policy failures. There's a shortage always of affordable housing or with the housing authorities like free housing. And the public transit system here that we use, um, it's not hard to get in, but the process to fill out is kind of extensive. With us, pregnant individuals, veterans, adolescents take priority of care due to policy mandates, which it doesn't happen often, but leave other vulnerable people slips into cracks. Service delivery can be seen through anti-racist and anti-oppressive lens. It means it's challenging with these inequalities. So for us to be able to push for more holistic all-around care and inclusive policies to ensure everyone, not just some, can get access to care. So as part of the capstone, we had to write a paper. So this presentation builds on my paper and which emphasizes cultural sensitivity and ethical practice with social work in life as well as in the field that I'm working in. Um, Proposing to have a full-time CRS that can help with advocacy and anti-oppressive frameworks and service delivery, recommending system level advocacy with housing and transportation to ensure that the clients here that are here for drug and alcohol are not getting denied due to that, which I have seen happen with housing. Clients get denied due to being in treatment for substance use, or their backgrounds that they're trying to change and fix. So, being able to be advocating for them and as well as inclusive and quality care on all system levels. The paper and this project are rooted in ethical reflection and a commitment to improve outcomes through practices, placing an emphasis on anti-oppressive and anti-racist practice at all levels. So not just here, us individually, but advocating for them at a policy level. So that in a community level, that way we can say, like, listen, like, I get it, these clients have been through a lot, they have a record, but they also need housing too. It should not just be limited. So ethical social work practice looks at the demand in cultural humility as well as the sensitivity of it. So for us, here at Pyramid, we offer Subutex again for pregnant women, which is considered culturally responsive and ethical. We accommodate Medicaid and public funding. We don't only take private practice where I have seen other places, and we aim to be non-discriminatory against aligning with the CARF and ACM standards. We don't turn people away because they have a record or because they're having a hard time funding. We help with the funding. So there is room for improvement, such as advocating or hiring opportunities for those who are multilingual or culturally diverse, who are from rural backgrounds, ensuring that we have the abilities to be informed, and serve those of the LGBTQ plus immigrants as well as those from rural backgrounds. Ethical practice requires that a social work and us whole as a program are able to recognize the equalities that are happening within the system and work to break down the barriers between clients and their effective treatment. Again, hiring staff that is diverse and pushing for these interventions that align with different cultures. This is where we can align with that in the NSA Code of Ethics by providing service, dignity, and integrity when working with our clients. Onto the needs assessment and systems advocacy. So, cultural sensitivity and anti-practice in this field can be reflected here at Pyramid across all of our levels of care, from individuals to a policy standpoint. So, from the individual and family level, we have the MAT that is tailored to clients' needs, as well as our flexible scheduling to ensure that the clients are still getting treated here while they can still live their outside lives. They can still put their kids on the bus, get them off the bus, um, things like that. So having the groups and as well as the CRS supports here within our organization builds respect in group settings. From an organization standpoint, have being CARF accredited and ACM accredited holds us to standards while being able to coordinate with the community as well as local services. That helps to build us some collaboration, such as like partnering with BDAP and Blair Senior Services for housing and transit. Um, Research and policy levels have shown a lack in help because it's inclusive outreach and the systemic advocacy part of it. So expanding our services to their groups that are underserved as well as engaging in policy reforms is key because transportation funding as well as anti-oppressive practices and offering these clients an equal chance of getting the same services as someone who maybe wasn't addicted to something at one point in their lives, who may not have a criminal record. So trying to open the door for our clients who are trying to get their lives together with things such as the Department of Housing Services, things like that, who often will turn down our clients because of their history, because of their past, because of their drug use, etc. Bias, power, and privilege. So as a social worker, going through schooling, being into this, going through the code of ethics, etc., it's super aware of knowing what my biases are, as well as where my power and privilege sits with clients. I have reflective supervision once a week with my clinical supervisor, and we talk about like how I am feeling. Um, some things that I'm having a hard time with and looking whether it is bias backed or if it's just something that's actually grounded or ethical. So being aware of where I come from and remembering that my past was not always the best either, kind of dismantles the power and privilege part of it. At nowhere in time, do I feel like that just because I'm on one side of the desk and they're on the other, that I have power over them. And I do tell them that, like, just because I'm sitting here doesn't mean I'm not a human too. So responding to our client stories in a real manner, being realistic with them, not sugarcoating things, and ensuring that you're not trying to be a hero to the clients because that can lead to false hope. Um, Pausing to think about how systemic power plays into everything with these clients and being a better advocate for clients when they actually need it, supporting their independence, being there to support and advocate for them. I'm not here to be their friend. I'm here to listen to them and try to guide them in the right direction. Back to policies and stuff. So with Medicaid, our biggest policy factor we work with right now is Medicaid and the Medicaid expansion. So we here at Pyramid rely heavily on social welfare policies. We're always trying to stay up to date with the new policies and what that means for our clients, especially in regards to funding. So Medicaid shapes who can get care and how that care is delivered. At other facilities, they do not accept Medicaid, but we do. So being able to tell our clients how the Medicaid meshes with our stuff, as well as how flexible the benefits are and what's available for them, um, to ensure that their care they're receiving here is fair and centered on the individual and supportive. So Medicaid is widely used here, and we support the clients that are coming in for treatment for substance use, mental health, through the psychiatry program, and also it'll cover the CRS services. So our Medicaid expansion, like when the expansion happens, it increases the eligibility and use of services here. Some of the restrictions other clients have found at other facilities is that it limits or enables acceptance. Not here, though. We accept Medicaid. With the integrated care models, it enhances how effective the Medicaid is by looking at the social needs of the clients. And social determinant supports include supporting engagement that is sustained as well as better outcomes. So ensuring that because these clients have Medicaid, what else can we do to ensure that they can utilize this care, such as finding them resources for dentistry or family medicine practices, etc. So advancing the human rights and justice, Pyramid's alignment with ACM and CARF work to promote ethical and non-discriminatory care to clients. This shows that we as a program have a strong commitment to human rights as well as ethical care. There's obviously still room to grow, bringing in more justice-focused policies. Um, this is where it opens opportunities to advocate for safe housing that is near services here for our clients. It provides access for better and or simpler transit access for whether they're using the bus or the van or etc. And utilizing CRS for services to help push for policy changes on a local level. So, culturally responsive advocacy means that we are to meet clients where they are. So, clients may come in from inpatient where they have a little bit of sober time. Other times they come in straight off the streets and may still be using. So, meeting clients where they are in their treatment. Are they new to treatment? Have they been to treatment before? What has worked? What has not worked? And supporting them in ways that go beyond just care. So, having a full-time CRS in the building at all times that does not have a caseload, almost as like acting as a case manager, but also providing that peer support, gives clients real-time personalized support to them. It also can help clients to navigate tough things such as they can help with housing applications, transportation support, job services. They can help them build a resume, can help with financial support, take them to meetings, AA or NA meetings. They may take them to doctor's appointments, things like that. CRS staff bring in diverse lived experiences than we do. They step into advocacy roles, pushing for some policy changes to remove some of the bigger barriers that our clients are facing. So by building stronger community partnerships, right now our CRSs are working on policies with other facilities to bring clients in here to receive their MAT So they see us as counselors once a month. They are able to go and get their MAT here, and then they go back to the half house, three-quarter house in which they're staying. So they help with the transportation for that. They actually brought a whole new program, a whole new facilities program to us so that we're able to start seeing their clients as well. So overall, Pyramid Healthcare's outpatient program offers a really important lifeline for those suffering from substance use disorders and mental health challenges. We're flexible, evidence-based, and we have a strong peer support with our CRS. So there are still gaps though, especially when it comes to cultural inclusivity, housing support, reliable care, um, housing support, sorry, and reliable transportation, not care. A few changes could really help, such as firing a full-time CRS to be here in the building at all times with no caseload, hiring CRSs that are multilingual, different backgrounds, etc. These steps because they help with local housing and transportation, strengthening some of the partnerships with the local housing authorities, as well as having a way for us to provide transportation that is easier and more tech friendly for some of our clients. Um, these steps would not only support longer term outcomes for these clients, but help them to stay on track with sobriety, able to move our program closer to more a socially just model that is anti-oppressive, and making sure that we are backing our care and ensuring that we are providing culturally responsive care that is built in the program. This will help for lasting and more meaningful recovery with our clients.